Start.
Good morning, everybody. Today we are going to deal with a very important chapter called diagnosis. That is, it forms a very important part because in ortho, suppose you are in conservative or some other department, you make a diagnosis wrong, it goes, you do the treatment also wrong, you can correct it because you will come to know within a week, few weeks, or maximum in a few months. But in ortho, the treatment itself is 1.5 to 3 years. So you make a wrong diagnosis, you wait for 3 years, and then you come to know that your treatment plan was wrong because your diagnosis was wrong. Then patient is going to be with you as your roommate till his treatment is completed. Okay. So diagnosis is a very important part of ortho, because if you do the diagnosis part correctly and perfectly, treatment is not a very big deal. The treatment is the easiest part. But what treatment to do for which patient, that you have to determine based on the proper diagnosis. So put it simply, summarizing the symptoms. Symptoms means what the patients tell you. Understood? And signs. Signs means what you find out. Symptoms is what the patient tells, and signs is what the patient you find out from the patient or examination or some investigation of the patient. So summarizing the symptoms and signs of the patient to evolve a proper treatment plan. This is what diagnosis is. Okay, this is not any proper definition or something. This is for you to understand. All the things you get from case history, examination, investigation, x-ray, everything you summarize in, so that based on that summary you can plan the treatment. This is diagnosis. Okay. As far as orthodontic diagnosis is concerned, there are certain aids. Aids means not the disease aids. Aids means for help, or which one, something which you take as a help. Understood? So orthodontic diagnostic aids. This usually comes as a main question. Mention the orthodontic diagnostic aids, and they may ask about some particular aid or some investigation or something. So you have to just remember orthodontic diagnostic aids. If they ask question, you write the heading orthodontic diagnostic aids. This orthodontic diagnostic aids can be of two types. Basically, they are classified as essential diagnostic aids and supplementary diagnostic aids. Okay. So now coming to the essential aids. Now, essential means something which is done for all the patients. Almost 90% patient you have to do all this. All these diagnostic aids are used for 90%. Almost 90% of the patient you have to use this. For example, first one in that is case history and examination. This is the very important part, because this will decide most. This is almost 60% of the diagnostic aids. Then you have study models. So you take study models, and we also have a section where we analyze the models. Okay, you have to analyze the models, which is called as model analysis. And there are clinical photographs. We take clinical photographs. There are two types of photographs. Okay, intraoral, where we take the teeth in different views. We ask the patient to bite, take the occlusal view and all that. And we have extraoral, that is the face from the side, from the front, oblique view, smiling, all these things. So you have case history and examination, which is very important. Study models, where we analyze the models. Then we have clinical photographs, intraoral, extraoral, and some radiographs. Certain radiographs like IOPA. Okay, IOPA is taken depending on what we think the etiology may be. We will discuss this in detail when we come to the provisional diagnosis. Then we have OPG. OPG is also very important. It's taken for almost 60 to 70% of the patient. Lateral ceph. Now this lateral ceph is a bit confusing because it comes in essential, or we can put it in supplementary also. Essential, why I am putting it is, if the patient has skeletal malocclusion. We have already discussed what is skeletal malocclusion. If the patient has skeletal malocclusion, then lateral ceph is a essential aid. Dental, then it becomes supplementary. So depending on the malocclusion, which you would have ascertained already from the previous case history and examination, if you suspect skeletal malocclusion, then lateral ceph is a essential diagnostic aid. Understood? Now, Under supplementary diagnostic aids, we have different things. There are around 20 to 30. I just mentioned a few. You can see the textbook for the rest. This itself is a separate chapter which will be dealt in a separate session. Okay, under supplementary, I'll just mention the names. Certain advanced radiographs. That means other than the radiographs which we have already covered, we have other radiographs. One of them is called SMI. SMI means radiographs which are used to assess the skeletal development. Okay, for example, hand wrist radiograph, mid palatal suture radiograph, cervical vertebral radiograph. Like that, we have certain radiographs used for SMI. Then we have, if the patient has TMJ symptoms, we have to go for different TMJ views, transorbital, transpharyngeal, lateral, etc., etc. Then you have the occlusal radiograph, that is maxillary occlusal view, mandibular occlusal view, especially if there is any impacted tooth, etc. Then MRI, all of you know what is MRI, magnetic resonance imaging. Then you have computed tomography or cone beam computed tomography. Then in IOPA itself, that is in the IOPA, using IOPA film only, we take what is called shift cone intraoral periapical radiograph, that is usually for impacted teeth. Okay, it comes as a short note. If not in ortho, it will come definitely in radiology. Then you have cine radiography. Okay, cine radiography, just remember it is like a cinema, okay, but with X-ray film, and it also comes as a short note. So just remember this. I will discuss when we talk about tongue thrusting habit. Okay, cine radiography is used in tongue thrusting mainly. Then you have Kessling's. Okay, Kessling is the person who gave it. Kessling's diagnostic setup. Then you have endocrine test, depending on what, if you suspect pituitary is wrong or thyroid is wrong, like that, different endocrine tests. Then you have electromyography, that is EMG. Then you have zero radiography. Okay, then you have lots of things like this. You have digigraphy and you have lithography, like that. You have different salivary tests and all those things. But this is a separate chapter. Today we are basically going to deal with case history and examination.